Nivi is a consumer-facing digital health marketplace, which is a bit of a mouthful. Marketplace implies two sides coming together, both typically buyers and sellers. We like to think of it here as providers and consumers. The marketplace is where we bring together those two elements for exchange, for learning. We do this through a bit of artificial intelligence, data, and behavioral science to ultimately help individuals realize their own health goals. So we start with the premise that things are not perfect. I know, big surprise. Things aren't perfect. In the health sector, there are many challenges. Health educators would like to be able to reach or engage their target audiences more effectively. Service and product providers would like to sell more, would like to do more, would like to provide more, public and private, right? It's not just a private sector problem, it's also a public sector issue. Health payers, often think about that, but financiers, those social health insurance funds that we hear a lot about taking off in certain markets, would like to reach new policyholders as well as keep or retain the policyholders they have and help avoid unnecessary cost and optimizing health. And finally, supply side or supply chain actors like manufacturers, but also distributors, wholesalers, they'd like to know more about what consumers know. Do consumers, from a manufacturer's perspective, do consumers understand that exposure to A causes disease B, and that their product C could help interrupt that cycle? So there's a lot of engagement that different health sector actors would like to be able to foster, and we help do that. So Nivi in that cycle can help generate awareness, generate uptake, and sustain adherence to products and services, as well as a result of its engagement with both sides, if you will, generate insights from the data around consumer demand and behaviors. So that's really what we've set it up. And we do this, we offer what we can by, at its core, building on awareness, building on a chat experience, a chatbot experience through WhatsApp that generates awareness, leads to activation, action, and adherence or retention. So we are predicated on doing what we do through WhatsApp in 3 markets currently. We're in India, Kenya, and in Nigeria. And in all 3 of those markets, we work with partners to generate awareness. There's a call to action in multiple marketing campaigns. It could be something done online through social media or using influencers. It could be done on the ground using community-based agents, ASHAs and community health workers to generate awareness around a particular health topic. And very critically, putting out that call to act, that call to action, where a consumer, because they're curious, because this resonates and is relevant to what they need, that call to action is pointing them to ask questions, to go to and use Nivi, the chatbot. As users, as individuals onboard into Nivi, then they're asked 3 critical questions: age, gender, and location. And from that, then they, after that, begin to explore tailored content, conversations that are relevant to them on particular health topics, including family planning. We are at the Reproductive Health Innovations Exchange, RHIE today, and thinking about family planning, thinking about other reproductive health concerns. And so we have a range of topics, including the ones within, including family planning, HPV, HIV, and other primary health concerns. We're developing or expanding our content to address things around tuberculosis, around malaria. The idea with all of that, with each of these health topics, is to lead to some kind of action. That action might be going in for an HIV screening or a pregnancy test, or maybe looking for specific family planning contraception. And so we can help support decision-making by asking consumers to answer a few questions about their fertility preferences or contraceptive histories in the case of family planning, to make targeted recommendations, relevant recommendations on what product or products would be useful for them, or which services would be useful for them, and critically, where they can find those products and services. So you can think of this as that end-to-end experience, raising awareness, the behavior change components, and where to act, where to behave, where to culminate, where to see that demand satisfied. And critically, not only where to go, but then asking, once the recommendation has been made, did you go? How was it? What was the experience like? If you didn't go, well, why not? Was there a challenge with financing, challenge with transport, challenge with, in some cases, insecurity? It's certainly a concern in Nigeria these days. And so understanding where consumers are at requires being with them and asking more about their experiences day to day, and helping to solve for those problems where we can. Now, we can't do everything, but we can do more together. And that's fundamentally how we've set this up. So that end-to-end experience from awareness to action is baked into the 3 different products you're seeing here. For our nonprofit partners and others working on more in the development space, working on grants or grant cycles, contracting Nivi on an annual basis for behavior change is a very practical and can be a very cost-effective way of working in India, Kenya, or Nigeria. One subscription in each of those markets will unlock multiple projects. So we can work with your organization to serve multiple projects with multiple timelines, and you can use Nivi, one subscription, in multiple instances. We can work with your commercial partners as well. So thinking about if you have partnerships on the ground to work with, say, pharmacies or hospital networks, we can partner directly with those private sector entities, and on a commercial basis. You can think of this as setting up the sustainability model. Nivi can work with them. You can, in fact, introduce us to your pharmacy and hospital networks, and we can work directly with them on a commercial basis out into the future, well beyond that grant cycle. And so this becomes a way to unlock sustainability for those development sector partners or agents that are looking for something that moves or lives beyond the grant cycle. Lastly, there are a class of organizations, to date, most of them on the supply side, on the manufacturers. They'd like to know more about the shape of the demand curve. What do consumers understand between A or B in terms of exposures and disease outcomes, for instance, and helping work with them to unlock these insights. So we are also partnering with manufacturers in this space. It's fairly new. So these are examples of customers we're currently working with, and we'd love to work with you as well. They're familiar names in there: Pathfinder, Society for Family Health in Nigeria, Japigo, FHI, Population Services. Don't have their icon here, but we've worked with them as well on that Nivi impact or behavior change piece. And then some other newer innovative entities and for-profit partners in the Kenya market, in particular, Maidawa and Kasha and HealthX. We're working with Mari Stopes on a referral basis into their provider networks in Kenya. And then lastly, working with Merck, or MSD as they're known outside of North America, to uncover insights in a therapeutic area of interest to them. So others have used us, have used Nivi's ability to engage populations, have found that chat very productive and more cost-effective than trying to build their own. That build or buy question that we all at an organization level will face. And so, yeah, that's effectively what Nivi does. We've been very useful. I think our track record speaks for itself, and excited to hear more today about what you all have, any sort of questions. If you do have questions, feel free to reach out. I realize today's very brief, but do reach out to me via email,